The topic of my talk revolves around how best to use these tumor markers, both serum tumor markers for cancer and also for like the molecular PCR-based biomarkers. I have to sort of walk the fine line between advising to test for these biomarkers and also when not to test, because there is a specific indication for each of these tests. Where some of them can be used for screening, for diagnosis, and for surveillance. Some of them have less sensitivity and more specificity. So each of these tests have their own like nuances that you have to be aware of in terms of when to test and when not to test. So in a resource-limited setting such as ours locally, patients have to pay out of pocket, and some of these more expensive tests are coming from commercial labs. So these tests can be a bit pricey and expensive for most of our patients. So resources are one of the biggest stumbling blocks in our setting right now. A better healthcare system, if that's possible. Universal healthcare is a big word to throw around, but it has to start somewhere. So I hope there are policymakers who are involved in providing resources where they're needed, especially for cancer patients who don't have a lot of time to work with. So giving them the resources to allow access for more testing, the right testing, and the right treatment is really should be the work of our policymakers. I hope there's more, and I hope it reaches more people, both lay people and also doctors, because I think cancer patients can come in through different fronts, like general practitioners, pediatricians, pulmonologists, and oncologists, so they can present to different parts of the field of the medical profession. Educating and empowering all those people from different subspecialties in our profession will allow for better care and management of these patients.